Imagine stepping on a nail and feeling nothing, or having a heart attack without pain. That's the reality for nearly half of people with diabetes due to diabetic neuropathy. By the time symptoms appear, significant nerve damage has often already occurred. Today we're tackling diabetic neuropathy, a serious, often silent complication that can threaten your quality of life. It's not just numbness or tingling, it can be life-threatening if ignored. We'll break down what it is, how it sneaks up on you, and what you can do to protect yourself. Up to 50% of people with diabetes develop neuropathy, often over 15-20 years, so awareness and early action are critical. Let's dive in and arm you with the knowledge to take charge of your nerve health. Diabetic neuropathy isn't just one condition, it's a group of nerve disorders, each affecting your body differently. First, peripheral neuropathy, the most common type, starting with tingling or numbness in your feet, legs, hands, or arms. This loss of sensation is dangerous. Injuries can go unnoticed, leading to infections or even amputations. Next, motor neuropathy. This affects muscle control, causing weakness, loss of balance, and difficulty with coordination. Everyday tasks like buttoning a shirt or walking steadily can become challenging. Cranial neuropathy targets nerves in your head and face, causing symptoms like facial pain, double vision, or difficulty swallowing. The most dangerous is autonomic neuropathy, which disrupts automatic body functions, heart rate, blood pressure, digestion, bladder, and even your body's response to low blood sugar. Symptoms are often subtle or absent, making this type especially risky. You might experience dizziness when standing, digestive issues, bladder problems, or sexual dysfunction. Most concerning is the loss of hypoglycemia awareness. Your body stops warning you when blood sugar drops dangerously low. Without these cues, severe low blood sugar can strike without warning, leading to confusion, seizures, or even coma. Autonomic neuropathy's silent progression makes it particularly perilous. You may not feel pain, but vital systems are being disrupted. That's why understanding these types is crucial for anyone with diabetes. To recap, peripheral neuropathy affects sensation, motor neuropathy impacts movement, cranial neuropathy targets the head and face, and autonomic neuropathy disrupts your body's automatic functions. Each type brings unique challenges, but autonomic neuropathy often carries the highest risk due to its silent, widespread effects. Recognizing these forms early can make all the difference. Stay alert to subtle changes in your body. Early detection and action are your best defense. Let's keep moving and see how these complications can become life-threatening. One of the most dangerous effects of autonomic neuropathy is its impact on your heart. It can cause a heart attack with no warning pain. Normally, your heart sends pain signals during distress, but damaged nerves can silence these alarms. A heart attack might happen without chest pain, just subtle signs like unexplained sweating, nausea, fatigue, or sudden changes in blood sugar. These clues are easy to miss, delaying life-saving care. That's why people with long-standing diabetes must pay attention to any unusual symptoms, no matter how minor. Regular cardiac checkups, including ECGs and stress tests, are vital for early detection. Autonomic neuropathy can also cause orthostatic hypotension, a sudden drop in blood pressure when standing, leading to dizziness or fainting. This increases the risk of falls and injuries. Sweating abnormalities are common. Some sweat excessively, others not at all, raising the risk of heat stroke or dry, cracked skin. Sexual dysfunction is another real consequence. Erectile dysfunction in men, decreased libido, or dryness in women. These issues are treatable, so don't hesitate to discuss them with your doctor. The key message: autonomic neuropathy disrupts your body's internal balance, especially your cardiovascular system. From silent heart attacks to daily blood pressure swings, the impact is profound. Recognizing these complications early is crucial for proactive management. Comprehensive diabetes care means looking beyond blood sugar. Regularly assess for these hidden dangers. When nerves fail, your body's regulatory systems break down, reducing quality and length of life. Don't let silent complications go unnoticed. Stay vigilant and work closely with your healthcare team. Early action can save your heart and your life. Next, let's talk about why your body's warning system can fail entirely. Severe autonomic neuropathy can erase your body's early warning signs for low blood sugar, a condition called hypoglycemia unawareness. Normally, symptoms like shakiness, sweating, and anxiety alert you to eat sugar before things get dangerous. But with nerve damage, these alarms go silent. You might feel fine as your blood sugar plummets, only realizing something's wrong when you're confused or even unconscious. This makes everyday activities, like driving or being alone, much riskier. Hypoglycemia unawareness requires a new approach to diabetes management. Your doctor may recommend higher blood sugar targets to avoid dangerous lows, even if it means a slightly higher HbA1c. Safety comes first. Preventing severe lows is more important than perfect numbers. Continuous glucose monitors, CGMs, are game changers. They track your sugar 24/7 and alert you to drops, acting as an artificial warning system. Family and friends should know the signs of severe hypoglycemia and how to help, including using glucagon if needed. Education and preparedness are essential. The loss of your body's warning system shows how silent nerve damage can be deadly. Recognize the signs of diminishing awareness and adjust your care plan with your medical team. Use technology and support networks to stay safe. Don't ignore changes. Address them immediately. Your safety depends on proactive management. Now, let's see how regular testing can catch these problems early. Early detection is your best weapon against diabetic neuropathy. Annual screening is essential. For peripheral neuropathy, your doctor will use simple tests like the monofilament and tuning fork to check sensation and vibration in your feet. They'll also inspect your feet for injuries you might not notice. For autonomic neuropathy, screening includes questions about digestion, bladder, sexual function, and blood pressure checks when standing. More specialized tests may be used if needed. Consistency is key. Get screened at least once a year, starting at diagnosis for type 2 diabetes and within 5 years for type 1. Early detection can slow or even partially reverse nerve damage if blood sugar control improves. Once damage is severe, it's often permanent, so act early. Continuous glucose monitors help spot dangerous patterns and prevent complications. Your annual checkup should also include eye, kidney, and heart assessments. These complications often go hand in hand. Think of screening as your yearly health audit. It empowers you and your doctor to make informed decisions. Don't wait for symptoms, make screening routine. It's an investment in your future health. Now let's talk about what you can do to defend yourself against diabetic neuropathy. The cornerstone is good blood glucose control. Keep your HbA1c as close to target as possible, usually below 7%. High blood sugar damages nerves over time, so consistent management through diet, exercise, medication, and monitoring is crucial. Address other risk factors, control blood pressure and cholesterol, and quit smoking to protect your nerves' blood supply. Maintain a healthy weight and stay active. Exercise improves blood sugar, circulation, and even helps with nerve pain. If you already have neuropathy, early intervention matters. Medications can help manage pain, and specific treatments target symptoms like gastroparesis or blood pressure drops. Regular visits with your diabetes care team are vital. They'll help you adjust your plan and catch problems early. For those with peripheral neuropathy, daily foot checks are non-negotiable. Look for cuts, blisters, or changes, and see a podiatrist regularly. Always wear well-fitting shoes and never go barefoot. Your best defense is a proactive, multi-pronged approach. Manage blood sugar, address risk factors, live a healthy lifestyle, and stay connected with your care team. There's no cure for established neuropathy, but these steps can slow progression and help you live well. Don't wait for symptoms. Act now. Prevention and early action are your strongest tools. Stay informed, stay engaged, and take charge of your health. Every step you take makes a difference. Empower yourself with knowledge and action. You have the power to protect your nerves. Let's wrap up with your next steps. Diabetic neuropathy is common, but early detection and good blood sugar control can make a huge difference. Annual testing and keeping your HbA1c below 7% are key. Some damage may even be reversible if caught early. Knowledge and proactive care are your best defense. If you found this helpful, like and subscribe for more essential diabetes info. Check the description for resources and watch our next video on the blood sugar numbers that matter most. Remember, managing diabetes is a journey. Use your resources and work with your healthcare team. Thanks for watching, and take care of your nerves.